Hello, Professor. Hi, everyone. My name is Amara Olibo, and this is my SOAP note for week 4 presentation. So, let me start up. My patient in issue is JC, and JC is a 16-year-old male, white male, came into the clinic accompanied by his father for routine wellness checkup. Patient is alert, father is alert, and good historian for this visit. So Jason is an established client in this facility with no significant health history. His last wellness visit was February 15, 2022, and patient is in 11th grade, plays basketball in school for activities. For the father, patient is doing well in school, denies any sickness, any health concern. Um, Patient's medical problems. So patient report that he has sprained his ankle 3 months ago while playing basketball. However, reports that the symptoms resolved without complication. So preventive care for my patient. His last dental exam was on July 7th, 2022, while his last flu shot was October 7, 2022. Patient denied any surgery, denied any hospitalization, no medication usage, and no allergies. Family history, paternal grandfather is 69, history of diabetes. Paternal grandmother is 67, has history of arthritis. Um, Maternal grandfather 66, history of hypertension and diabetes. For maternal grandmother is 66, history of hypertension. While patient mother is 39-year-old, no pertinent medical history. Father has history of motor vehicle accident and is on wheelchair. Patient has two brothers, 14 and 11, and they are both healthy, no health issues. Patient social history. JC lived with his parents and two brothers in a story house. His father works with Pacific Gas and Electric as an IT product specialist, while his mother works remotely as an administrator. So patient enjoys staying at home and enjoys playing with his brother. Denies any risk, any concern at home. Patient love playing basketball, which he does at school and sometimes at home as well. Patient is up to date with his immunization, all immunization including 3 doses of Hep B, 5 doses of DTaP, and 1 dose of Tdap are up to date. Patient is on regular diets. Patient reported that he eats more on carbohydrate because of his activities at school. He denies the use of he denies drinking soda or juice. He reports that he drinks a lot of water instead, and milk a lot during breakfast time. Patient has no issue sleeping. Um, 8 to 9 hours of sleep reported each day. Patients listen to music or play basketball when upset. So patient developmental milestone. The father reported that JC is well mannered. His mother had no health concern during pregnancy. The child was delivered normally with no complication. Mother did not smoke, did not drink, did not do drugs during pregnancy. The mother had no postpartum depressive symptoms, and the patient has no girlfriend as at this time, but has shown interest in the opposite sex. He manages his school as well as homework effectively. He's a fast learner and can play instruments as well. So patient as well reported that he plays piano, which is very good. Okay, Rose, all patients Rose are all within normal functioning, no issues. Patient denies any um, medical problems. Okay, and objectives. So patient vital signs is pretty much within baseline. Heart rate is 80. Blood pressure is 116 over 64. Temp is 98.6. Respiration is 18. Pulse ox is 99. Patient's weight is 140. His height is 72 inches. His BMI is 92. So patient is pretty healthy. So the general survey, patient appears generally healthy, is alert, reliable, historian, and cooperative as stated before. Um, Everything is pretty much stable with JC, and he equally denies any issues. So my differentials for this visit is for this encounter is for routine child health examination without abdominal findings. That's my first differential. So the findings with no findings. The patient presented, and reason for this is because the patient presented for an annual wellness checkup, and after doing my assessment, there was no abnormal finding. So that is why um, uh, my examination without abnormal finding was one of my differentials. The second one is encounter for sex education. Okay, the patient stated that he has never engaged in any sexual activity. Additionally, he does not have a girlfriend. However, he has started showing interest in the opposite sex. The patient was provided sex education, so I provided on JC sex education, particularly on the prevention of sexually transmitted infections. Because studies have shown that the international mean age for first sexual intercourse was 14 to 16 years. Therefore, this was an appropriate time to provide sex education for my client, which is my patient Jason. So my third differentials is screening for tobacco use. Okay, although my patient denied the use of tobacco or illicit drugs, tobacco screening and counseling were provided during this visit. Studies have established that early 90% of smokers start smoking before the age of 18 years. So that is why this was part of my differential diagnosis. Contributing factors and negative effect of tobacco use we discuss with the patient and his father, with verbal understanding to every education and teaching. So my final diagnosis is a cancer for routine child health examination without abnormal findings. In this primary diagnosis, in this case, the gathered data did not reveal any physical, social, developmental, or psychological issues facing the client. So my plan diagnostic not necessarily at this time. So no diagnostic testing or plan is necessary at this time. There was no treatment required. However, there was education. Okay, the client was educated about RICE, which in full is rest, ice, compression, and elevation method due to this history of ankles, which is because the patient had history of ankle sprain. So this education was provided in case if Jason encountered such issues again. So patient was advised to practice RICE, which is the rest. The patient will rest, as explained to the patient. Rest, you apply ice, compression, and elevation. Okay, and so the next one is the client was encouraged to maintain healthy dietary behavior, including fruits and vegetables. Servings of whole grains and low-fat dietary products was reinforced. Patient was encouraged to continue obtaining this in the safest way to prevent STIs. Okay, to prevent STIs, he should also come for proper condom use education when necessary. Okay, JC also was educated not to indulge in tobacco or other drugs, and also to wear mouth guard when playing basketball and seat belt when driving also. So to keep headphones and also to keep headphones at a moderate volume to protect his hearing. Patient was also encouraged to continue building healthy relationship with his family and friends. So follow up visits for this patient is in 1 year at the age of 17 for wellness visit, and of course patient was encouraged to visit the clinic or ER if there's any health concerns or health issues going on. So this brought to the conclusion of my soap note presentation. Thank you very much. I'm going to put it up and put my references as well. Thank you very much, Professor. Thank you very much, my fellow student.